this is Madeline. Today we'll be performing a modified knots test. This is essentially a heartworm test that we will perform, and at the end we'll read for microfilariae, which are the immature heartworms. To perform this test, we need 10 ml tubes. We're going to mix 9 ml of formalin with 1 ml of anticoagulated blood. So we'll just put our 9 ml of formalin in our tube. And then this is 1 ml of our blood, so we'll pull that up in a pipette and mix it in the same tube. Okay. And then we'll invert the tube gently a few times to mix the solution. And then we are going to put it in our centrifuge and balance it. We'll start it at 1500 RPM for 5 minutes. Okay, so it's been 5 minutes. Our centrifuge is finished. So we're going to pull our tube out. And we are going to go to the sink here because we need to discard of all of the supernatant on top. So we'll leave the pellet there at the bottom. We're going to put 1 drop of blue stain in here. We'll mix the solution with our pipette. Then we'll put a drop of this on our slide. We will cover it with the cover slip. And then we'll read and we'll look for any microfilariae. Scan back and forth real quick. And I am not seeing anything, so that means that this dog tested negative for microfilariae heartworms. Hi, this is Madeline. Today we will be demonstrating a fecal flotation exam. To do this, I have already collected my fecal sample and I've put it on my loop here. This is approximately 2 grams worth of feces, and then our container that we'll use to float. The solution that we're using is a sodium nitrate solution. So we'll start by filling up our container about halfway, and then we will disperse the sample. We'll fill the rest of the container up with solution. And you don't want to overfill it, but you want to fill it up to where there's this little meniscus at the top, so that it actually makes contact with our slide. We'll place our slide on top, set our timer for 10 minutes, and when the timer goes off, I'll put the cover slip on the slide and read it under the microscope. Hi, this is Madeline. Today we'll be performing a direct smear fecal test. To do this, I have a slide and my fecal sample as well as some saline. So the first step is to get some fecal material on your loop here. I'm going to tap drop it on the slide. And we get all the big pieces of debris out of there. We'll put 1 or 2 drops of saline on the slide. And then we will mix the solution until it's homogeneous. We can read it that way. Looks like that. And then we will put our cover slip over the sample. And it's ready to read. Hi, this is Madeline. Today we'll be performing a centrifugation with flotation fecal test. To do this, I'm first going to collect approximately 2 grams of feces from our patient, and we're going to put it into our cup to mix with some fecal solution. 2 grams. Fill the cup with our fecal solution. Mix this up and try and break down any large pieces. And then we're going to be transferring into a container that's the same size as this one for straining purposes. And then once our solution is strained, then we'll put it into our tube that will fit into the centrifuge. So we'll put our gauze top of this container. Okay. Then we'll remove this piece of gauze. It just has all of the large chunks of fecal matter in here. And then this is our strained solution, so we're going to transfer this into our centrifuge tube. Be sure to leave some space near the top. Cap this, and we'll take this over to our centrifuge. Sure it's balanced. And we'll start it at 15 RPM for 5 minutes. Okay, so it's been 5 minutes in our centrifuge, so we're going to pull our sample out. I'm going to take it back over here. We're going to fill the rest of the tube with some more fecal solution until it forms a meniscus at the top. We'll place a cover slip at the very top. We'll set our timer for 10 minutes, and when the timer goes off, we can then put the cover slip on a slide and read it under the microscope. Hi, this is Madeline. Today we will be performing a fecal sedimentation test. To do this, I'm first going to collect approximately 2 grams of feces, and I'm going to put it into a cup here. So it's approximately 2 grams. And we'll fill this cup up with our fecal solution. We'll go in and mix this up and try and break down the larger pieces of feces. And then for straining purposes for this test, we're going to transfer this solution into a cup of the similar size just for straining. And then we'll put that solution into our centrifuge tube. So in this cup here I have a piece of gauze on top to act as our filter. We'll slowly filter this solution through. Okay. And we'll pull this gauze off the top here. And then our strained solution will go into our centrifuge tube. We'll bring it over to our centrifuge here. Make sure it's balanced. And then we will start the centrifuge at 1500 RPM for 5 minutes. Okay, so it's been 5 minutes. We're gonna pull our sample out of our centrifuge. Using our pipette, we're going to discard all of the supernatant that's sitting on top until we have just the sediment at the bottom. And then using our pipette again, we're going to suck up a bit of the sediment there. Place that directly onto our slide. And then apply a cover slip, and it's ready now to read under the microscope. Hi, this is Madeline. Today we will be demonstrating a urine collection free catch. I have my patient here who's on a short leash so that she can be near me when it comes time to collect the sample. And then to collect the urine, I'm using an old sterilized measuring cup. Certain facilities have containers specific for this, but other facilities use old soup ladles, measuring cups like this. But it is 8 a.m., which is the perfect time to collect a urine sample. It should be concentrated and should have the best reading for a sample. So we're going to go outside. You want to catch the urine midstream, meaning waiting 1 or 2 seconds after they begin urinating and then catch the sample. That way you can avoid any contamination of your sample that comes from like their fur or anything. But we'll take this sample and we'll go inside to analyze it. Okay, so we have our urine sample in our cup still, so we're going to transfer it to a sterile container to analyze it. So I'm going to use this pipette, pull up the urine, transmit it to our tube, and then to be able to analyze it, we'll put it up against like a white sheet of paper so that we can get an accurate reading of color and turbidity. Color-wise, it looks pretty concentrated and it's slightly cloudy, both of which make sense being it's 8 a.m. And the dog hasn't been drinking water for about 12 hours. Start recording. Hi, this is Madeline. Today we'll be collecting urine via cystocentesis. There's a couple ways to collect urine, a couple different methods. The first one is just blind sticking, and to do this you would use your patient and put them on their dorsal back and then just pool alcohol where you think their bladder would be, and naturally the alcohol will just pool over the urinary bladder and then you can just stick in that way. You can also use the ultrasound as a guide, using the ultrasound probe, locating the urinary bladder, and then going in with your syringe that way. Today we'll be demonstrating a palpation isolation method. To do this, I have my syringe to collect the urine, 2 separate needles, a replacement needle, and some alcohol. So I will get his side wet with alcohol first for sterilization. I'm going to locate the bladder, so I'll use my non-dominant hand and cup underneath, and then pinch with my thumb up here with gentle pressure, and then sliding forward until I can isolate it. So I have it isolated, not putting too much pressure on so I don't accidentally express the bladder, but we're going to go in with our needle and only insert it about halfway. And then pull out. So we'll change our needle for sterilization because the skin has contamination on it and you don't want that in your sample. We'll put it in our tube for analysis. And just like with the other urinary collection methods, we'll put it up against a white sheet of paper. The sample is very concentrated, or not concentrated, so the patient's hydrated, and turbidity is clear, so it looks like just normal urine for a patient. Hi, this is Madeline. Today we'll be placing a urinary catheter in a male dog. To do this, we have a couple of different catheters that we could use. Our clinic carries red rubber catheters and then the polypropylene catheters. That's what these ones look like. They're sterile, so I'm not going to open them. But these are the catheters that we'll use for bigger dogs, or if we know that they have a urinary obstruction. They're more firm and they're less flexible, so they'll go through the obstruction easier. And then if you want to follow up with a more flexible catheter afterwards, then you can. But we'll be using the red rubber ones today because they are more flexible. This is kind of our practice catheters. It's not sterile, but we wanted to mark it so that we know how far we should place the catheter in. So we're leaving the last 2 inches of the catheter that will be outside of the penis, and then it will kind of curve up this way past the pelvis into the urinary bladder. And you want it probably 2 or 3 inches past the neck of the bladder. That way you're getting a good urine sample. But this is roughly where we'll place the sterile catheter. For positioning our patient, usually they're either lateral or they're on their dorsal back. For dogs, usually it's lateral. And I'll have an assistant holding the leg up so that I can get to the penis. But we need to be sterile, so I have sterile gloves here that I will put on. Super important that this procedure is sterile. Okay, so we'll open our catheter here, exposing probably like the first half of it. We have sterile lube that we'll be using, and kind of just want to pool it here in the center so that way when you're extracting the rest of the catheter, it coats the part that's going into the penis with lube. So before we place the catheter, I'll have my assistant hold the leg for me. I'm going to grab down here at the base of the penis and then expose the tip the penis. There's water here that we're going to use, and we're just going to lavage the penis. Just getting rid of any external debris that could contaminate. We'll use our catheter. Enter right at the head of the penis and then carefully thread it through slowly. There. And then I'm going to use a sterile collection device to pull my urine sample, so I'll have my assistant grab that. We're gonna pull out this first cc of urine. We'll dump that because that urine has been sitting and is likely contaminated. So we'll just dump that and then pull more urine from the actual urinary bladder to get our sample. Okay, I'm gonna place that in my collection device over there, which is just a sterile white top tube. And then I'm gonna slowly remove the urinary catheter. Okay, and then we'll evaluate our sample. Just like with the free catch urine, we'll put it up against a white sheet of paper. That way we can evaluate concentration and turbidity. This urine looks pretty normal in regards to color and concentration and turbidity also. It's not cloudy at all, so it looks like the patient is able to concentrate its urine and it's hydrated. That's it. Hi, this is Madeline. Today we will be obtaining and analyzing an ear cytology. To do this, I have our slide and then a Q-tip to obtain the sample. This patient presented for head shaking and scratching specifically at the left ear. So we took a look. The right ear doesn't have any debris in it. The left one does, so we're going to take a sample. To do this, I'll use my dominant hand holding the Q-tip. My non-dominant hand, I'll hold the pinna, which is this portion of the ear, upwards. The tragus is this little flap of tissue here, and we're going to collect our sample behind there because that's usually where most of the debris sits. So we're going to go straight down into the ear canal, roll around a little bit to get a sample, and then we're going to take this debris and just gently roll it back and forth on our slide. We'll wait for this to dry and then we'll stain it and analyze it under the microscope. Okay, so our ear cytology has dried. It's been about 15 minutes since we collected it, so we're going to stain it now. We have our stains here. We're going to start with the blue. We'll wash the whole area, let it sit for approximately 5 seconds, and then we will dump the excess.
No doing surgery?
Repeat the same thing with the pink. And then lastly with the purple. And then we're going to very gently rinse the back side of the slide with some water. Be sure we don't wash ourselves off of that. Now the slide is considered ready to read. So we're going to put it on our microscope and we'll start at 10x for our power field. We'll start there just to get kind of a general idea of what we're looking at. I'm gonna put it on a higher power field, so we'll put a little drop of mineral oil on our slide, and then we'll change the power field to 100. And then read again. I'm not saying much, it just looks like a lot of wax. There are a couple footprints of yeast on there, so I'll probably grade it like a 1+ yeast infection of that dog's left ear. I don't see any bacteria. And the scale is 1 to 4, so 1 being like mild infection, 4 being severe. This is a mild yeast infection. Hi, this is Madeline. Today we will be demonstrating obtaining a fungal culture. I am going to be using sterile hemostats to collect my sample, but you can also obtain your sample using a toothbrush. So I'm going to take my sterile hemostats out. And then I have my media jar here to place my sample in. The area that I'm taking the sample from is this kind of hairless region here by his dew claw. The reason I'm taking my sample from here is because it's presenting with hair loss. The fungus usually starts growing at the center of the lesion and then comes outward, so we're going to obtain our sample from the outer part of the lesion. So I'm going to collect hair out here. And you know you have a good sample when you can see the follicles of the hair, because that's where the fungus grows. So we're going to take our sample. We're going to lightly tap it onto the auger here so that it plants itself in there. And then we'll put the top back on, but we're not going to screw it all the way on to where it's airtight because you need oxygen to get in there. So we'll leave the lid kind of balancing on there, and then we'll put our sample in the cabinet where it's room temperature and dark so that it can culture. Hi, this is Madeline again. It's been about 14 days since we took that sample to start our fungal culture on our dog. Usually when we start our fungal cultures within the first 3 to 5 days, if it is positive for fungus, then we'll see a red color change. Kind of looks like this. And then in 4 to 7, if it is positive again, then this will kind of sprout up like a white fuzz. But we didn't see any of that initially, so we just let the culture continue to grow. It's been 14 days, like I said, so we're going to evaluate this microscopically. Looking at it right now, it doesn't look like it's positive for anything because it's not white. If it sits long enough, it can become red just from contamination. So we're going to check anyway under the microscope. So I'm going to get just our slide here. We're going to put 1 drop of our stain in the center. And then we'll get a little bit of our sample. I'm just going to lightly scrape the top here. And then we'll kind of tap this onto our stain and mix it in. And then we'll put our cover slip on top.
This is Dr. Maynard here at Penny Glen Animal Hospital.
Now we can view it under the microscope. We're going to start at 10, powered of 10x.
We've got x-rays completed.
To evaluate it.
There's definitely some problems up in the lung tissue. It almost looks like a herniation in the diaphragm muscle.
So,
the separation.
Not really seeing any signs of any microsporum species. It just looks like it's environmental contamination, which is just confirming what we thought initially, but no signs of an actual positive indication of a fungal infection. Hi, this is Madeline. Today we'll be demonstrating a skin scrape. To do this, I have a slide, I have a surgical blade, and I have mineral oil. 1 drop of mineral oil on the center of my slide. I'll remove my blade. For this patient, we have concerns of demodectic mites, so we'll be doing a superficial scraping. If we had concerns of another mange like sarcoptic mange, we'll do a deeper scrape, but for this one we'll start superficial. I'm going to get both sides of my blade damp with the mineral oil to help better collect my sample. This is the area of hair thinning that we're concerned about here on the thigh. So I'm gonna take my non-dominant hand and kind of stretch the skin, so that way I avoid any accidental lacerations. I'm gonna take the blade and place it transverse to the patient. We're just gonna do small strokes, all in the same direction until you come up with a small ulcer. It might bleed or ooze a little bit, but it shouldn't be actively bleeding. We have a little sample there. We'll place that on the slide. And then we will put this under the microscope and read it. Okay, so we have our skin scrape cytology here that we're gonna evaluate microscopically. So we'll start at our basic field power, which is 10x. You don't necessarily need to put a cover slip on, you can just read the slide as it is, and it doesn't need any staining. Just kind of scan back and forth here. So I'm seeing demodectic mites on the slide, and they look like little slow-moving cigar-shaped organisms. It looks like there's roughly 3 or 4 mites per field, which means that this dog needs treatment for demodex, so we'll go ahead and get him treated. But this dog is positive for demodicosis. Hi, this is Madeline. I'm here with my preceptor. This is Dr. Lisa Hansen. We'll be performing a necropsy on a kitten that presented initially for upper respiratory symptoms, but as she stayed in the hospital, or he was leaking urine into his perineal area, and that's ultimately why he was euthanized, is because he was going septic. So that's the reason we're performing the necropsy today, is to uncover the reason. We are dressed in our PPE, which includes gloves, masks, and gowns. And so she'll begin her procedure. She's going to do a brief external exam, and then we'll open the kitten up and we'll obtain our 2 samples.
So on exterior examination, we're going to look at the eyes, then the nose, the mouth. Here you can see that there's some discharge that dried around the animal's face, has very foul breath. That's important to take into consideration. We'll look at the ears, looking for any trauma around the head. Everything seems to be intact. Evaluate the musculoskeletal system. This cat was euthanized a few days ago, so he is going to be firm with some of his organs as they are still thawing out, but just checking everything out. Here in the back you can see where we had some swelling, so this is going to be a point of investigation to determine if there is a congenital defect. So from the outside, the cat is intact, and we will proceed with our internal evaluation. So I'll have Maddie assist with kind of holding him. We're just going to make a midline incision, and we're going to open from top to bottom. Usually animals that have congenital deformities have more than one issue, so even though he didn't come in with anticipated heart abnormalities, that is something that we do want to check. So now that we've gone through the skin, we're going to kind of open up through the musculoskeletal. Be careful not to cut into any of the organs. We're going to go into the chest cavity. Use our Mayo scissors to break through the ribs here, so we can check all of the chest cavity out. once we get our patient opened up, we'll kind of separate things so we can get a better evaluation. So I'm going to identify the cat's heart, which seems a little large for his size. We have normal kind of postpartum changes here to the lung tissue. Generally speaking, what you'll want to do is you want to take out all the way from the tongue, the esophagus, the lungs and the heart in one pluck, but we're not searching the animal for something like that today. We're just doing a brief evaluation. Everything looks okay. What we will be doing is taking the heart for submission of biopsy. We'll send that out for evaluation. Beyond the chest cavity, we have the diaphragm separating the two cavities. And our patient is still a little cold. We have the liver here up top, and our small intestines. Stomach's hiding behind there, as well as our spleen. Everything appears to be normal. Our kidneys are fine bilaterally. Here's our bladder. This is a point of concern. Looking for either trauma or a congenital defect. We're going to open a little further to go down to this pouch where we have fluid collecting. Basically working through the muscles back here, just trying to figure out what part of the urogenital tract failed. So off to the side here, it looks like it's part of the urethra. And it just formed a little out pocket. Bunch of cellulitis on the tissue. So what we'll do is we'll sample this and we'll try to take it all the way down to the urethra, and then we'll give the heart for both biopsies. So we're going to take out the heart. We'll just kind of spread the cavities.
And this jar is labeled heart, which is what we're submitting. Patient's first name, which was Squirrel, and then usually we put the client's name, but we just put Pflugerville Animal Welfare Services, which is the shelter that works down the street. That's where this cat was homed. The next jar is labeled with the same information: Squirrel, Pflugerville Animal Welfare Services, and then urogenital tract, because that's the second thing we'll be submitting for biopsy.
Okay. So at this point, what we'll do is we're going to close the patient and we'll submit it for cremation.
Hi, this is Madeline. Today we will be obtaining a vaginal cytology. I have my patient. I have gloves on to keep it sterile, and then I have sterile saline flush, my slide, and then a sterile swab. So the first thing I'm going to do is take our flush, and we're going to wash the vulva. So I'm going to expose it here. Just kind of flush the whole area. And we'll keep the tail up so it doesn't contaminate the area. This is our sterile swab. So my non-dominant hand, I'm going to push the vulva up, peel this back and expose this mucosal tissue here. I'm gonna use the swab and I'm gonna insert it at like a 45-degree angle and then just rotate back and forth. Saturate the swab. Here. And then take this sample and roll it onto our slide. And we'll let that dry, and then we'll stain it and analyze it. Okay, so our vaginal cytology has dried. It's been about 10-15 minutes since we obtained this, so we're now going to stain it. Very similar to the ear cytology, we're going to use these 3 stains. We'll start with blue. We'll saturate the whole slide and keep it sitting for approximately 5 seconds. We'll dump the excess. Go in with our next color, which is pink. Wait 5 seconds. Dump excess and then go in with our last stain, which is the purple. Wait 5 seconds. And then we will gently wash the back side of the slide with some water. Okay. And our slide is ready to read, so we'll start at our 10x power field. And evaluate the cells real quick. There's not a whole lot of cells on here. There are a small number of parabasal cells, but that's pretty much it. Our dog that we took our sample from is a spayed female, so that makes sense. I'm going to gauge her stage of estrus as anestrus, which is when parabasal cells are present, and clinically that's when their ovaries are inactive, so they're not in heat, they're not reproductive. So that's the stage for our dog. There are other stages. Proestrus is when the vulva is enlarged, and there may or may not be bloody discharge. That's when they're going into heat. Microscopically, they can have large intermediate cells and erythrocytes. Then you progress into estrus, which is when they're technically reproductive to the male. There's like a 3 to 5 day window in there. Microscopically, there's large intermediate cells also. No neutrophils though. And then the next stage is diestrus, which is when they're coming out of their heat cycle. The vulva usually shrinks and then the bloody discharge stops. Microscopically, there are neutrophils, and then there's an increase usually in the small intermediate cells, and then anestrus, which we went over before. Then yeah. Hi, this is Madeline. Today we will be performing manual blood type testing. We had our donor and our recipient dogs, and we've already drawn blood from them. So we have a lavender top tube and a red top tube for each animal, and they've been centrifuged already. So the first step that we're going to take is we're going to take the serum from the red top tubes and place them into new tubes and set them aside for now. So this is for the donor. Pull the serum out into here. Okay, we'll set that aside, and then we'll do the same thing for the recipient. And then with our lavender top tubes, we are going to discard the supernatant. So we'll pull some more pipettes here. This is blood for the recipient. So we'll pull top supernatant out. Until we just have the packed red blood cells at the bottom. Then we're going to pull 1 to 2 drops of the red blood cells into our pipette, and we'll place it in a new glass tube. And then we're going to fill up the rest of the tube with our saline solution. This is for the recipient, so we're gonna repeat the process that we just did for the donor's blood as well. So again, we'll come over here, discard the supernatant. Come back over here, pull 1 to 2 drops of red blood cells from the bottom. Place that in a new glass tube. And then again, fill up the rest of this tube with saline. And then we're going to take both of these tubes that we just collected and we'll place them in the centrifuge. And we'll start them at 3,400 RPM for 1 minute. Okay, the centrifuge is done after a minute, so we're going to pull our samples out. And with each tube, we're going to come back to the sink and discard the supernatant. We're going to repeat the process by filling the tube back up with saline. That was for our recipient, so now we're going to repeat the same thing for our donor. And then same process, fill it up with saline again. We'll put both of our tubes back in the centrifuge and repeat the same process at 3,400 RPM for another minute. Okay, it's been another minute. Our centrifuge is finished with our second phase of the washing process. So we're going to repeat it one more time with each tube. So the recipient's tube is here. We will again discard the supernatant at the top, leave the packed cells at the bottom. Solution and fill the tube back up. And do the same thing here for the donor's sample. saline solution again. We'll repeat the same process with the centrifuge. This is our last step for the washing process. And I'm back in at 3,400 RPM for 1 more minute. Okay, our last minute on the centrifuge is up. We're gonna pull our samples out. So the supernatant is now colorless, which is what we want. So we're going to take each tube one at a time and discard of the supernatant, just like before. This is the recipient's tube. Leave the packed cells at the bottom. Put that to the side for a second. Do the same thing with the donor's blood and pull the supernatant off. Okay, so we're done pulling the supernatant off of our samples. So now we are going to take 0.02 mils from each sample tube. So we'll start with the donor. 0.02. Place it in a new tube. And we're gonna add 0.98 saline, which I've already drawn up here. Make 1 mil. So that's the erythrocyte suspension for the donor. We'll put that to the side. Toss that. And then we'll do the same thing for the recipient. So we'll pull up 0.02 of our packed cells. Put it in our new tube. And then again, add our 0.98 saline. And this is our erythrocyte suspension for our recipient. Okay, so now we have our suspensions in our tubes, and then we have our serums on this side. So we're gonna make our major and minor cross matches. So for the major, we need 2 drops of our recipient serum. Put it in our new tube. And we're going to add to that 2 drops of the donor's erythrocyte suspension. And that's our major cross match, so we'll put that off to the side for now. For our minor cross match, we're going to take 2 drops of the donor's serum. One, 2. And we're going to add 2 drops of the recipient's erythrocyte suspension. And that is our minor cross match. Okay, so now we are going to make our control tubes. So for the control recipient, we're going to take 2 drops of the recipient erythrocyte suspension. Put it in a new tube. And then 2 drops of the recipient serum, its own serum. 1, 2. And that's the control for the recipient. So same thing for the donor. Take 2 drops of the donor's erythrocyte suspension in a new tube. And then 2 drops of the donor's serum. One, 2. And this is our control for our donor. So we're going to take our 4 tubes and invert them a couple times gently. And then we're going to place them on a rack at room temperature and incubate for 30 minutes. Okay, it has been 30 minutes. We're now going to take our 4 tubes and place them in the centrifuge so they balance each other. Make sure they're closed tight. And we're gonna start them at 3,400 RPM for 1 minute. Okay, so it's been 1 minute. We're gonna pull our samples out of the centrifuge. We have our major, our donor control, our recipient control, and our minor cross-match. So just visually inspecting these, major does not look hemolyzed. Give it a little flick and see if I can see anything. Still looks the same, colorless. Control for the donor looks the same, not hemolyzed, which is good. That's how it should be. Minor cross-match. Doesn't look hemolyzed either. Still nothing, which is a good sign. And then control for the recipient is the same as the other 3, not hemolyzed. So just to make sure, we're going to microscopically evaluate the major and the minor cross matches. So we'll bring them over here. For the major, we'll pull a drop out of here and place it on our slide. And put a cover slip over. And then we'll do the same thing for the minor. Pull a drop out of here. Place it on our slide. Put the cover slip on. So we will examine these at 10x for our power field, and we'll look for any clumping. So this is the major cross match. They look pretty evenly spaced out. Don't see any clumping, which is good. Okay, that's good. So we'll just double check with our minor and do the same thing. Still don't see any clumping. Okay, so the cells are evenly spaced out on that one as well, which means that the 2 patients that we picked, the donor and the recipient, are compatible for a blood transfusion.